Welcome to another test from the Practice Test Geeks. In this video we are going to test CNA Basic Restorative Services. For answers and explanations check the description below and our website for more tests. Question 1. A contracture, tightening, or shortening of a muscle is caused by A. Old age. B. Lack of movement of the muscle. C. Pressure on the muscle. D. Too much exercise. Question 2. Proper body mechanics dictates that when lifting an object, the nurse aide places feet. A. It doesn't matter. B. 3 feet to 5 feet apart. C. 12 inches to 18 inches apart. D. 6 inches to 12 inches apart. Question 3. A patient is leaving the hospital. The family has been told to give her medication SPID. The wife asks what that means. The nurse aide tells her to give the medication. A. 3 times a day. B. Once a day. C. Only when needed. D. Twice a day. Question 4. Mr. Johnson has just returned from surgery. Which of the following things do you do? A. Notify family about the surgery results. B. Turn, cough, and deep breathe, leg exercises. C. Check vital signs every 4 hours. D. Immediately give medication to control nausea. Question 5. A patient has had hip surgery. Her legs should be A. Abducted. B. Adducted. C. Elevated. D. In the most comfortable position for the patient. Question 6. A nursing assistant is helping a resident to walk. If the resident becomes faint and begins to fall, the assistant should A. Hold the resident up and continue walking. B. Ease the resident to the floor and call for help. C. Carry the resident back to bed and then go for help. D. Hold the resident up and call for help. Question 7. What is the process of restoring a disabled client to the highest level of functioning possible? A. Retention. B. Rehabilitation. C. Responsibility. D. Reincarnation. Question 8. Exercises that move each muscle and joint are called A. Adduction. B. Range of motion. C. Abduction. D. Rotation. Question 9. Goals of arthritis care include A. Strengthening bones and muscles. B. Decreasing inflammation and preserving joints. C. Preventing contractures. D. All of the above. Question 10. The nurse aide documents that about 45 minutes after the resident is put to bed for an afternoon nap, the resident urinates in bed. To help with bladder training, the nurse aide should A. Remind the resident that it is important to cooperate with bladder training. B. Take the resident to the bathroom right before going to bed. C. Report to the registered nurse that the resident will not succeed in bladder training. D. Take the resident to the bathroom after about 30 minutes of being in bed for the nap. Question 11. What can you do to allow a helpless resident some independence when he must be fed? A. Feed the resident lying down. B. Ask which foods the resident would like to eat first. C. Always stand to feed the resident. D. Feed the resident with a fork. Question 12. The primary goal of restorative care is A. Return the resident to a normal life at home. B. Do everything for the resident. C. Take care of the resident's personal business. D. Keep the resident comfortable in the nursing home. Question 13. ROM exercises will help prevent A. Pressure sores. B. Depression. C. Obesity. D. Contractures. Question 14. You are delegated to provide passive ROM to L lower and upper extremities. This means you A. Watch how many times she moves left lower and upper extremities in 15 minutes. B. Extend root arm over the left side of the body. C. Support each joint and provide extension and flexion movements on the left side of the body. D. Have patient raise left arm and leg 10 times. Question 15. The nurse aide just admitted a new resident. Which of the following is the most restorative approach? A. Encourage the resident to participate in unpacking. B. Tell him he'll need to unpack for himself. C. Unpack all of his clothes and put them away for him. D. Encourage a family member to unpack for him. Question 16. When the nurse aide moves a joint during ROM range of motion exercises, and the resident complains of pain, the nurse aide should A. Stop the movement at the point the pain occurs and report to the nurse. B. Ask the nurse to give pain medication so the exercises can continue. C. Stop giving the resident any ROM exercises. D. Push past the point where the pain occurs to see if it still hurts. Question 17. Pressure sores can often be prevented if the client is A. Turned or repositioned every 2 hours. B. Dressed in loosely fitting clothing. C. Positioned with a pillow under the head. D. Placed in an incontinence brief. Question 18. The role of the ombudsman is to A. Control the nursing home budget. B. Prepare classes that nurse aides take to learn about client hygiene. C. Run a group of nursing homes. D. Work with the nursing home to protect clients' rights. Question 19. The nurse aide is making an occupied bed. Which of the following is the most restorative approach? A. Do everything for the resident. B. Encourage the resident to help. C. Lower both side rails. D. Tell the resident to get out of bed. Question 20. Equipment used to help the resident maintain correct body alignment includes all of the following except A. Splints. B. Cones. C. Bed cradles. D. Foot supports. Question 21. When ambulating an unsteady client, it is best for the nurse aide to use a walker. B. Quad cane. C. Gait belt. D. Wheelchair. Question 22. The most basic rule of body mechanics is to A. Bend from the knees and hips. B. Never use a lift belt. C. Twist as you lift. D. Keep the arms flexed. Question 23. After assisting with evening care, the nurse aide notices the client has bilateral hearing aids. The nurse aide understands that if a hearing aid is not in use, it should A. Be left on the client's bedside table. B. Be placed in the client's pocket. C. Be left turned on. D. Have the battery disengaged. Question 24. If a client has hand tremors, the nurse aide should A. Tell the client to stop shaking and to control the tremors. B. Assist the client with the activity of daily living as needed. C. Restrain the hand that has the tremor. D. Do everything for the client to avoid embarrassment. Question 25. If a button hook and a sock assist are all part of what kind of nursing care? A. Activities of daily living. B. Disability and reactivity. C. Prosthetic mobility. D. Restorative and rehabilitation. For answers and explanations, check the description below and our website for more tests.